Hello everyone. Today, we're delving into the world of a medication known as polyethylene glycol 3350, commonly recognized by its brand name, MiraLAX, as well as its generic name. As always, this discussion is intended for educational purposes only. If you have any health-related questions or concerns, it's essential to seek guidance from a qualified medical professional. Description: Polyethylene glycol 3350, also referred to as MiraLAX, is an over-the-counter laxative used to relieve occasional constipation. This medication belongs to the osmotic laxative class and is known for its gentle and effective action. It works by drawing water into the intestines, softening the stool and promoting regular bowel movements. MiraLAX is often recommended for short-term use, providing relief from constipation in both adults and children over the age of 6. It is typically used when dietary changes or lifestyle modifications are insufficient in alleviating constipation. Warnings: While polyethylene glycol 3350 is generally considered safe for short-term use, there are certain precautions and considerations to keep in mind. It should not be used if you have a known allergy to the medication. Individuals with severe or persistent abdominal pain, nausea, vomiting, or a sudden change in bowel habits should not use MiraLAX and should consult a healthcare professional instead. Before taking this medication. Before using polyethylene glycol 3350, it's essential to discuss your medical history and any current health conditions with your healthcare provider. Inform them if you are pregnant, planning to become pregnant, or breastfeeding, as they can provide guidance on the appropriate use of MiraLAX in these situations. If you have a history of bowel obstructions or other gastrointestinal disorders, it's crucial to inform your healthcare provider, as MiraLAX may not be suitable for you. Additionally, discuss any other medications, supplements, or herbal products you are currently taking, as they could potentially interact with polyethylene glycol 3350. Side effects: Like any medication, MiraLAX may cause side effects in some individuals. Common side effects can include mild abdominal discomfort, bloating, cramping, or gas. These effects are typically mild and temporary. However, if you experience severe or persistent abdominal pain, rectal bleeding, or any other unusual or concerning symptoms, discontinue the use of MiraLAX and consult your healthcare provider immediately. Interactions: Polyethylene glycol 3350 is generally considered safe and has few interactions with other medications. However, it's always wise to inform your healthcare provider about any other drugs or supplements you are taking to ensure there are no potential interactions. Dosage: Proper dosage is crucial when using any medication. For adults and children over the age of 6, the typical recommended dosage of MiraLAX for occasional constipation is 17 grams, about 1 heaping tablespoon, dissolved in 4 to 8 ounces of liquid, once daily. It can be taken with or without food. Always follow the dosing instructions on the product label or as directed by your healthcare provider. Avoid: While using MiraLAX, it's essential to stay well hydrated by drinking plenty of fluids to support its effectiveness and prevent dehydration. Avoid using more than the recommended dose, as excessive use may lead to electrolyte imbalances or other complications. Additionally, refrain from using polyethylene glycol 3350 for an extended period without consulting a healthcare provider, as it is intended for short-term relief of constipation. FAQ: A common question regarding MiraLAX is whether it can be used in children. Yes, MiraLAX is generally safe for children over the age of 6, but it's crucial to follow the recommended dosage based on their age and weight. Always consult with a healthcare provider or pediatrician for specific guidance on its use in children. Closing. That concludes our overview of polyethylene glycol 3350, commonly known as MiraLAX. Remember, this information serves as educational guidance and should not replace professional medical advice. If you have any questions or concerns about this medication or your health in general, please consult with a qualified healthcare provider. Thank you for tuning in.